Good morning and welcome to this edition of the ABCs of Cumberland County. We have come to the letter F, and I'm going to be talking about the flu pandemic today. I'm Cara Curtis, and I'm the Archives and Library Director here at the Cumberland County Historical Society. So I started doing this research for the 100th anniversary of this event. And I didn't know when I started this that we'd be living with some of the same things so soon after I completed this research. So it's been interesting to compare. I am not a medical doctor, so I'm not going to get into detail about a lot of the science, but we have some resources that we can share, one journal article in particular, if you're interested in that side of things. So, there is a lot of research about this global health crisis in 1918. There is not a consensus on how many waves there were, when it started, when it ended, and how many people actually died. We do know that this was an H1N1 flu, which of course we've dealt with in more recent years at various times. And we do know that this flu hit a little differently. So normally with the flu, we're most concerned with our most vulnerable members of our community. This particular flu was particularly devastating for young adults, so people in their late teens to the 40s. And what were a lot of men doing in 1918 that were in that age range? They were fighting. So they were in trenches, they were in barracks, they may be malnourished, they may have damaged lungs from chemical warfare. So this flu really ravages the world's armies that are fighting. But this really does hit the entire world. It is a massive pandemic. There's also belief that elderly people may have had some immunities because there was a, quote, Russian flu in the winter of 1889 to 1890. So older people may have had some immunities when this flu came around. One thing that is striking, that I'm going to read, the historian John M. Barry reported that in 13 studies of hospitalized women in the pandemic, the death rate ranged from 23 to 71%. Of the pregnant women who survived, children, over one quarter, 26%, they lost the child. So that's obviously significant and heart-wrenching. Locally, into September. Locally, it hits the hardest in October of 1918. And into late September, we're being told it's nothing to worry about. This is just a normal flu. But by the end of September, things are changing quickly. And Dickinson is going into quarantine. And you're getting reports of this flu hitting the encampments, army encampments. By October 4th, the town shuts down. And this is kind of across Cumberland County. Carlisle definitely shuts down October 4th, but other communities and areas around the county are shutting down in a similar time period. The newspaper notes that possibly the shortest borough council meeting of all time was 5 minutes and quickly ended. When the town shuts down, it's closing down churches, schools, movie theaters, saloons, all sorts of things that are non-essential. The market house, grocery stores, other things are remaining open. This is also a time to think about medical care. There is no flu vaccine. There is no Tamiflu. There are no antibiotics for secondary infections. So there are things we can do now with the flu that we couldn't do in 1918 that can lead to better outcomes. Also, locally, this is a major transition in what kind is the shift to what we think of as normal medical care. This is still a time when doctors are making house calls, babies are born at home, and people are going to the hospital in extreme cases, in accidents, and things like that. The Carlisle Hospital, the old Carlisle Hospital, was just built in 1916, so it's still a brand new building. And we do know some flu patients ended up at the hospital, but most are being treated at home. We know also that the Red Cross Emergency Committee helped between 50 and 60 families over just a 2-day period. The community was threatened with quarantine at various times, but luckily the worst of it passed before that actually happened. The Carlisle Barracks at this point is an Army field hospital. And so the medical staff from the barracks is also coming out into the communities to help treat. The medical staff has been hit very hard. Nurses are sick, doctors get sick. It's wartime, so there's also gasoline rationing, but you could use your automobile and gas on times when you necessarily weren't supposed to if you were going to be helping get medical professionals to, as they called them, the country towns and other places that needed additional help. Local businesses were obviously also affected, and they talk about the effects more in terms of people getting sick than the economic hurt that they faced. The telephone operators were hurt, so that's obviously normally a female occupation. And they asked that people not make unnecessary phone calls. And this is obviously a time where you'd want to check in on your family. And they're asking you not to do that, not to make unnecessary calls, because they just didn't have enough telephone operators. The newspaper staff was skeleton. They still managed to get a newspaper out every day that had a paper, but they had a huge loss in staff numbers, the people that were sick. Other industry that they talk about regularly are the trolleys and the railroads were heavily affected. And not counting the loss in ticket fees, the Cumberland Valley Railroad paid out over $8,000 in relief money. They lost 6 members of their staff, and they paid $300 to each family. And 472 members were given sick benefits. The market house obviously is still open, although many stalls were empty. And they talk about the prices for things have increased. So for a dozen eggs, the price has increased to 57 cents. And there were also police officers kind of monitoring the market and patrolling to make sure that people made their purchases and moved along. There was no market gossip, so you had to make your purchases and go home, so you were not around to help spread or possibly infect yourself and take it home. So all of this goes on. The shutdown, Halloween's canceled throughout the communities. And in about a month, in the beginning of November, the town reopens slowly, and things return to normal, although the flu lingers. October is the worst. The numbers stay higher than normal deaths in November and December, and we know that there's another wave in January. Not nearly as bad as the October wave, but it definitely stays around through that winter. And to think about this in total deaths. So October, I'm going to give death numbers for October in 3 different years. And this is total deaths, so not just the flu. But in October of 1917, 62 members of our Cumberland County passed away. And in October of 1919, there were 54 deaths. In October of 1918, we lost 287 members of our Cumberland County community. And that's obviously a significant increase and affected many families. And obviously, this is also people that had death certificates issued in Cumberland County. So we had additional losses of men who were fighting or in army installations within this country as well. So the number is actually higher than 287. And obviously, dealing with that loss would be significant. And the newspapers from this time period are very much a mix of the war's in its finale. So it's very much war and flu are the headlines, and it's in your face, and it's kind of exciting to see the war coming to an end, and then horribly depressing with how the flu is ravaging this community. And how do you deal with that loss? And you see articles like mother buried with child or 3 deaths in one family. And I want to read one obituary or a newspaper article. And it's the 3rd son of Mrs. Solomon Gutschall dies yesterday. And this is from November. Roy Gutschall, the 30-year-old son of Mrs. Solomon Gutschall, died at the home of his mother, who resides on the Lindner farm near Watts Bridge yesterday after a short illness of influenza. Double funeral services will be held tomorrow for Roy and his brother, Private Guy Gutschall, who died at Camp Lee, Virginia, of spinal meningitis last Wednesday. This is the 4th funeral in the Gutschall family within 1 week. On Wednesday, funeral services were held for Mrs. Gutschall's son, Harry Gutschall, and his wife of Carlisle Springs. And while attending the funeral, the mother received the telegram stating the death of her son Guy at Camp Lee, Virginia. Owing to the death yesterday of Roy, it was decided to hold a double funeral service. So how do you recover from that? You don't. But the flu quickly passes from public memory. The soldiers are coming home. There's a big parade in June of 1919, and there's things to celebrate, and the want to get back to whatever normal is. But for many families, there is no normal. There is no returning to normal. You may have lost your breadwinner. There's not a lot of job opportunities for women. So how do you recover? Or maybe a father lost his wife and children. There is no normal for some families to return to, but everyone worked together to continue and to, just march on. Thank you for tuning in today. I hope you appreciated this 10-minute talk on the flu.